This is Radio Health Journal. I'm Reed Pence. This week, the new strain of COVID. Just how dangerous is it?
People that are not practicing mask wearing are going to be at higher risk getting infected from this one than the other one, which is already infectious enough, right?
Another big bump on the pandemic road when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We never know what the stock market is going to do, but on average, you can safely assume it's usually going to give a 6 or 7% return.
How to make your money work for you, rather than the other way around. Then,
the heat waves that we've seen in California, they have been made more intense and more likely because of climate change.
Uncovering the drivers of extreme weather events. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
More than 400,000 Americans have died of COVID-19 during the pandemic, and COVID wards in many parts of the country are at their limit or beyond. It's hard to imagine that things could get worse, yet it's possible that it might. In Great Britain and elsewhere, a new strain of coronavirus is spreading that's even more infectious than the one that's caused the pandemic. It's not widespread here yet, but the Centers for Disease Control and Prevention says it will be soon. They predict this strain will become the predominant one in the United States within a couple of months. Dr. Robert Bollinger is professor of infectious diseases at the Johns Hopkins University School of Medicine.
The big difference with this particular strain, it's got about 17 changes from sort of the original strain, and some of them are in parts of the virus where what's called the spike protein is located. And the spike protein is how this virus sticks to cells in our respiratory tract. And some of those changes seem to make the virus stickier than some of the other strains.
That basically means that the virus can get into cells more readily, multiply more, and therefore the individual who's infected with this strain of the virus sheds more virus, produces more. So when they exhale, more virus is in the air they exhale, which means that if you're in close proximity to that person, you're more likely to get infected. So it spreads more readily.
That's Dr. William Schaffner, professor of infectious diseases and preventive medicine at the Vanderbilt University Medical Center. He says British studies suggest that the new variant is about 70% more contagious than the pandemic version. Bollinger says it's no reason to panic, at least not if you're already following recommendations.
People that are not practicing mask wearing on a consistent basis, people that are not keeping their social distancing, people that are not practicing good hand hygiene and taking risks are going to be at higher risk from getting infected from this one than the other one, which is already infectious enough, right? So I think people that need to worry about this the most are those that are not already following the standard prevention strategies that are recommended. Fortunately, there's no evidence that we have yet that this particular strain is more dangerous when it does infect people than the other strains. It causes the same COVID illness that we see with the other strain.
However, Schaffner says even though the illness it causes is roughly the same, this variant's infectiousness makes it potentially much more dangerous.
Because it's more contagious, it will in time spread to more people. And eventually it will find people who are older, who have diabetes, underlying heart disease, or lung disease, and then those people are more likely to become sick simply because of their underlying basic conditions. And so the fact that it's spread more widely, it will find eventually people who are more likely to get severe disease. So as a consequence, more of those people will wind up in the hospital.
Avoiding that is the job of COVID-19 vaccines as well as masks and social distancing. But has this strain mutated so much that our brand new vaccines won't work against it?
There's no evidence at all yet that this particular variant is going to escape the immunity that's generated by the vaccine. So that's good news. There's certainly a potential for the virus, like any RNA virus, to mutate and escape vaccination immunity. I mean, that certainly happens with influenza every year. Certainly these RNA viruses, COVID is like influenza virus. It's an RNA virus, and they mutate. That's what they do. And so it's certainly possible that we would see mutations in the future that could escape this current vaccine strategy. But the good news is that we know how to deal with that. We've done that with influenza for decades now. We can adjust the vaccine that's needed, and we could do the same for this COVID if we need to. But fortunately, at this point, there's no evidence or concern that I'm aware of that this particular strain is going to be any less prevented than the other strains from vaccination.
However, since viruses mutate all the time, it's possible that this one, like the flu, may call for an annual vaccine tweaked to account for the latest version of COVID.
That's certainly on the list of possibilities. We don't know that for sure yet, but as we start rolling out the vaccine, we will monitor what's going on. We'll see for how long the protection from the vaccine lasts, and there may well be a need down the road for repeated booster doses of the COVID vaccine. And we may also have to alter the COVID vaccine from time to time to keep up with the virus, as we do with influenza. So this may be a little like our every 10-year tetanus shot, and maybe even more frequently, we're supposed to get our flu vaccine every year. Now, another bit of good news is the technology is such that the manufacturers could change that vaccine very, very quickly, even more quickly than influenza vaccine. So the next generation of vaccines could be produced fairly rapidly. But the need to wear that mask, social distancing, all those things, that remains.
Those precautions will remain for some time, since the rollout of the COVID-19 vaccine has been much slower than anticipated. Many experts blame the previous White House, which tossed the problem to states and counties. Now authorities are trying to figure out how to make up ground. One possible strategy is to stretch the time between the first and second dose of the vaccine from its current 3 weeks. Holding off on the second dose would leave more vaccine for other people to get a first dose. That's not how the vaccine was tested, but Schaffner says it's the strategy now being used in the United Kingdom.
They are trying to get a first dose into as many people as possible, and it looks as though our policy is moving in that direction. If you're going to do that, you have to be very assured by the manufacturers that they will keep producing vaccine so that we can give everybody the second dose, because we've told everybody this vaccine is 95% effective, but that's only if you get 2 doses. So we want to make sure that the flow of vaccine is going to be steady, and we have a system to remind people to come in and get the vaccine. Now, it may well be that under that kind of a program, the second dose doesn't occur exactly on time. But most of us think, arguing from other vaccines that we give to adults that require multiple doses, a little bit of delay doesn't bother your immune system. It will remember and respond. You don't have to start over. So I think there's a fair amount of comfort that we can have some delays, some stretching out of time between the 2 doses.
However, Schaffner says the longer the second dose is delayed, the more likely it is that people never get it at all. So it's important to remind recipients to come and get it. They may receive some protection from just 1 dose, but it's not optimum.
How long it will last is not known, and you don't quite get to the 95%. That's for sure. So there's every reason to get that second dose. We want to get you to 95%, and we want to provide some assurance that you'll have longer-term protection. With other vaccines, that's exactly what happens. That second dose really ups the amount of antibody you have, and the higher it is, the longer it's likely to last.
The data that have been released suggests at least There's some protection after the first shot, but, to really achieve the level of protection we're looking for, the second shot's necessary. You might get some protection with the first shot, but the studies weren't done to look at just one shot, right? They looked at the impact of two shots. And so, again, that's another part of science that we could certainly explore. We could look to see how big of a difference it makes and compare people that got one shot from two shot, but we don't have those data yet. So we should follow the science we have at this point. And if new information comes in that helps inform us to do things differently, we should certainly look at that. But at this point, I wouldn't recommend it.
The Food and Drug Administration doesn't recommend it yet either. They say anything other than the tested protocol is dangerous and could undermine the vaccine effort. But that's not stopping scientists from looking into new vaccination schedules. Researchers at the National Institutes of Health and at Moderna, developers of the second COVID vaccine approved in the U.S., are testing one possible plan. It would call for giving people 2 half doses of the vaccine rather than 2 full doses as used in clinical trials. The FDA is pushing back against that idea, too, and Schaffner agrees with them.
Half a dose was not studied, and that gets us really into unknown territory. So I would certainly not be very happy about half-dose policies until they were studied and shown to be as effective as 95%. I wouldn't want to give any of that 95%.
But is there more danger in it than that? Some people wonder if giving people half doses of vaccine might invite resistance from the virus, just as bacteria develop resistance when people don't take their full dose of antibiotics.
The question that comes up is, whether or not vaccine-induced immunity can put pressure on the virus in such a way that it mutates to escape the way we generate antibodies to fight it off. And certainly something that we track. It could happen certainly even with the current regimens we have the same dosing structures that we've just talked about. It doesn't necessarily have to happen only if you stretch things out or use half a dose. It has to do with the duration of antibody, right? One of the things we have to figure out is whether the current vaccines, the Pfizer, Moderna, for example, how long that immunity can protect people and whether they might need a booster. And so certainly the possibility the virus could mutate in such a way that it could escape even the current vaccine strategies.
Bollinger says tweaks in dosing aren't really important when it comes to COVID-19 evading the vaccine. What's more important is whether the current vaccine retains its efficacy against future viral variants. If not, we may need to tweak the vaccine itself every so often, as we do with the flu. Given the disease, it would be a vaccine that most people would want, but we'd need to figure out a better way to distribute it. Hopefully, we won't have to go through this every year.
There are places that don't have enough vaccine, and there are other places currently where they can't get the vaccine into arms. And so both issues are out there. But for sure, the more vaccine we have coming through the pipeline and getting to the end users, the more stimulus there will be to gin up our vaccination programs. And everybody's gone through the early patches now and discovered what works and doesn't. And I would hope that everybody is smoothing out their vaccination programs so that they can be extended longer in the day, on Sundays and Saturdays, and that things are moving more smoothly.
You can find out more about all of our guests on our website, radiohealthjournal.org, where you can also hear archives of previous segments. You'll also find us on Facebook, Twitter, and Instagram, and wherever you listen to podcasts. I'm Reed Pence. Coming up next week on Radio Health Journal.
You never know if this could be the exposure that could make you ill, that could kill you. And we have to be mindful of that every day. So we have to prepare ourselves. We have to gown up.
A visit to the COVID front lines.
Then, why athletes are among the most superstitious people on Earth.
These rituals that emerge also have a nice psychological function as they make them feel better. They fill the time with something that is routine and predictable.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.